I want you to think about someone you know, a parent, a coworker, a neighbor, someone who looks completely healthy, goes to work every day, laughs at dinner, seems totally fine. Now I want you to consider the very real possibility that inside their body, right now, something is quietly tearing them apart. No pain, no warning, no sign whatsoever. And they have absolutely no idea. That is not a scare tactic. That is the reality of high blood pressure in America today. Over 100 million Americans are living with this condition right now. That is 1 in every 3 adults. And nearly half of them have never been told, never been warned. Because this disease does something that makes it uniquely dangerous. It stays completely silent for years, sometimes for decades, until one day it is not silent anymore. And by then, the damage is already done. I have seen this story play out too many times. A patient comes in after a heart attack or a stroke. They are shocked. They felt fine. They had no symptoms. And when we look back at their history, we see blood pressure numbers that were dangerously high for years. Years of warning signs that their body never actually gave them. That is what makes high blood pressure the silent killer. And that is exactly why we need to talk about it today. So let me explain what is actually happening inside your body in plain language so it makes sense. Your heart beats about 100,000 times a day. Every single beat pushes blood through your arteries, delivering oxygen and nutrients to every organ you have. Blood pressure is simply the force of that blood pushing against your artery walls. Some pressure is completely normal and necessary. But when that pressure is too high and stays too high day after day, it slowly damages everything it touches. Your arteries start to stiffen and thicken. Your heart has to work harder and harder just to do its job. Your kidneys, your brain, your eyes, all of them are quietly being damaged, and you feel none of it. The numbers doctors use to measure this are simple. You have 2. The top number, called systolic, measures the pressure when your heart beats. The bottom number, called diastolic, measures the pressure when your heart rests between beats. Normal is around 120/80. If your top number is consistently 130 or higher, you are in high blood pressure territory. If it hits 140 or above, that is stage 2, and your doctor needs to know immediately. Now let me ask you something honestly. Do you know your numbers right now? Because most Americans do not. And that single gap in knowledge is contributing to hundreds of thousands of preventable deaths every year in this country. So why is this so common in America? Why are we seeing this at epidemic levels? A big part of it comes down to how Americans eat. The average American consumes over 3,400 milligrams of sodium every single day. The recommended limit is around 2,300. Most of that excess sodium is not coming from the salt shaker on your table. It is hiding in processed foods, canned soups, deli meats, frozen meals, fast food, bread, and sauces. Sodium causes your body to hold on to water, which increases blood volume, which pushes harder against your artery walls. It is that simple and that damaging. Then there is sugar. Most people do not connect sugar with blood pressure, but the research is very clear. Diets high in added sugar, especially from sodas and processed snacks, directly raise blood pressure over time. The average American consumes almost 3 times the recommended amount of added sugar every single day. And that is showing up in cardiovascular disease numbers across the country. Obesity is another major driver. When your body carries excess fat, your heart has to work significantly harder to supply blood everywhere. Fat tissue also releases inflammatory substances that damage blood vessels directly. With over 40% of American adults now classified as obese, the connection to the blood pressure crisis in this country is impossible to ignore. And then there is stress. This one gets underestimated constantly. Chronic stress keeps your body in a state of low-grade emergency. Hormones like cortisol and adrenaline stay elevated. Your heart beats faster. Your blood vessels stay tighter. What was designed as a short-term survival response becomes a permanent condition for millions of Americans dealing with financial pressure, job stress, family strain, and the relentless pace of modern life. Chronic stress is not just uncomfortable, it is physically destroying cardiovascular health. Poor sleep compounds all of this. When you sleep, your blood pressure naturally drops, giving your heart time to recover. When sleep is consistently poor or disrupted, that recovery never happens. Your heart never gets its rest, and blood pressure stays elevated around the clock. Now, let me tell you what all of this is actually doing to your body, because I think when people understand the real damage, they start taking it seriously. Your heart is the first to suffer. It thickens from overwork, loses efficiency, and becomes vulnerable to failure. High blood pressure is the leading cause of coronary artery disease and heart attacks in America. Your brain is equally at risk. High blood pressure is the #1 risk factor for stroke. It also slowly reduces blood flow to the brain over time, significantly increasing the risk of dementia and memory loss as you age. Many cases of cognitive decline that people assume are just part of getting older are actually the result of years of uncontrolled blood pressure. Your kidneys quietly fail. They are filled with tiny, delicate filtering vessels that get destroyed by constant elevated pressure. Hypertension is one of the top causes of kidney failure in the United States, and your vision can be lost. The small blood vessels in your eyes are extremely vulnerable to high blood pressure. Over time, the damage can cause permanent vision problems or blindness. All of this happening, none of it felt. So let us talk about what you can actually do, because this is where I want to give you real, usable information. The first thing is to know your number. Get your blood pressure checked. You can do it at a pharmacy, at a doctor's office, or with an inexpensive home monitor. This is non-negotiable. You cannot manage something you are not measuring. Second, cut back on sodium. Start reading nutrition labels. Cook at home more. Replace processed, packaged, and fast food with fresh ingredients as much as possible. Reducing your sodium intake is one of the fastest ways to see your blood pressure move in the right direction. Third, add potassium to your diet. Potassium directly counteracts the effects of sodium. Bananas, avocados, sweet potatoes, spinach, lentils, and beans are all excellent sources. This simple dietary shift makes a real difference. Fourth, move your body. 30 minutes of moderate exercise 5 days a week has been shown to lower systolic blood pressure by 5 to 8 points on average. Walking counts, cycling counts, swimming counts. Consistency matters more than intensity here. Fifth, manage your stress intentionally. This means actually doing something about it, not just acknowledging that you are stressed. Daily walks, time in nature, deep breathing, prayer, meditation, real conversations with people you trust. Find what genuinely helps you decompress and make it a non-negotiable part of your routine. Sixth, protect your sleep. 7 to 9 hours of quality sleep per night is not a luxury. It is a cardiovascular necessity. If you snore heavily, wake up exhausted, or have been told you stop breathing during sleep, talk to your doctor about sleep apnea. Treating it can significantly lower blood pressure on its own. And if your doctor recommends medication, take it seriously. For many people, lifestyle changes alone are enough. For others, medication is needed, and there is absolutely nothing wrong with that. Blood pressure medications today are safe, effective, and well tolerated. The worst thing you can do is avoid or stop them because you feel fine. Feeling fine is exactly what this disease wants you to think. Here is what I want you to walk away with today. High blood pressure does not wait for you to be ready. It does not give you a warning before a heart attack. It does not announce itself before a stroke. It just works quietly in the background for years until it does not have to be quiet anymore. But you have a choice right now. You can check your numbers. You can make changes. You can talk to your doctor. You can take this seriously before it forces you to. Because the people who end up in emergency rooms were not unlucky. Most of them just did not know. Now you do. Take care of your heart. It has never once stopped taking care of you.